Please can you remind me, if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? The purple angel, purple angel, purple angel.
Well, hey everyone, welcome to Alzheimer Speaks Radio. I'm Lori LeBay, the host and founder of Alzheimer Speaks, and I'm thrilled that you're with us today. For those of you that are new, I just want to tell you a little bit about who the heck we are. Alzheimer Speaks is an advocacy-based company providing multiple platforms to shift our dementia care from crisis to comfort worldwide. And we believe that by joining forces and sharing knowledge and just having these everyday conversations about life with dementia, that we're going to be able to remove the stigmas attached to memory loss and help those living with the disease continue to live with purpose. Together, we feel everyone has something to offer and help understand the true needs of this disease. So, again, welcome so much. I also have to thank each of you who, we just have such a great, solid listening base. From our core, we really thank you for helping us get recognized as the number one influencer online for Alzheimer's, according to ShareCare and Dr. Oz. And the only way that happened was through your clicks, your likes, in terms of sharing all of our information from our resource website to the radio show here to the dementia chats, webinars that we do, to our blog articles, and so much more that we offer on AlzheimerSpeaks.com. So please continue to do that. There are so many people in our own sphere of influence dealing with this disease that we don't even know are dealing with it, because this is still a conversation that's pretty private, and we need to get it out of the closet, and we need to get people talking about it so that we can get true remedies. And that's one of the things we're excited about today is we've got Molly Fogel with us from the Alzheimer's Foundation of America, and they're going to be talking about a new training program that they have developed to help improve our dementia care. So that's pretty exciting. I also want you to keep in mind that you might be our next guest. Do you have a story to tell? Have you developed a business that you think will provide a better life for people with dementia or those caring for them? Maybe you've written a song, maybe a movie script, a play. It's been fascinating what people are doing. Maybe you're a researcher. Please let us know, because we'd love to have you on the show and raise your profile and let people know exactly what's going on. Before I introduce Molly, I do want to just do a shout out to a few different organizations. And one of them here locally in Minnesota is HealthStar Home Health. They actually are working with the Alzheimer's Foundation of America, doing some memory screening here locally the week of November 1st through the 7th, because that is Memory Screening Week. And if you are interested, you can go to the Alzheimer's Foundation of America and find who is in your area that's going to be doing these screenings. Excuse my voice, it's allergy time here in Minnesota, and so I got the frog going on right now. I also wanted to give a shout out to the Alzheimer's Research and Prevention Foundation, and I'll be working with them November 17th. I'll get more information out, but we're going to do a little teleseminar that might be of interest to you. And those of you that are dealing with Lewy body, it is the Lewy body Awareness Month, all of November. So that is a wonderful thing to know. Excuse me. Last, I'm just going to shout out to a couple of my cohorts here on Alive and Social. And the first one I want to give a shout out to is Mortgages and BS. If you listen to them, they go live on Thursdays at 4 o'clock, and they unlock the secrets to home ownership and minimize the borrowing constraints. And you'll hear from the mortgage experts, Tom Smith, and radio personality BT, who's Brian Turner. And listen to those two unique personalities, and you'll see the relevant issues pertaining to home ownership mixed in with some spattering of just plain old BS. Another one of our Alive and Social brothers here is Apples to Apples, and you can find out if Father really knows best about sports on Mondays at 2:30 on the Apples to Apples show, where Scott and Drew Applebaum, father and son, kind of spew off, and you will find that they don't always keep everything in the family, and they have some kind of snarky commentary that'll leave you in stitches at times as well. So check both of those shows out on Alive Social. Let me go ahead and introduce Molly. Again, very excited to have her with us today. Molly Fogel is a licensed social worker, and she's the Director of Educational and Social Services at the Alzheimer's Foundation of America, and many of you know them as AFA. She has been in the field for 10 years, and she spent her career working to educate and improve the best practices within organizations, focusing on improving clinical skills in all staff and ensuring communities served provide an opportunity to improve overall health and wellness for people, especially with those with dementia. So welcome, Molly. How are you doing today?
I'm doing great. Thank you so much for having me here.
Well, you're out in New York, if I'm not mistaken.
Yes, we are.
Well, hopefully the weather's nice.
It's a nice and chilly day today.
Is it? Yeah, it's beautiful here in Minnesota. The leaves are changing and very fun. It's just all the allergy stuff that comes with that season change. But I do like our seasons. Well, let's go ahead and get started here. I'm excited to hear about what you guys are doing. Now, you have developed a dementia-specific training that is just vital for healthcare professionals. And why did you feel that was something that was lacking in the industry?
Yeah, so, there's a number of reasons why we feel that we needed to create a newer training for healthcare professionals, specifically a dementia-specific training. So, there's more than 5 million Americans living with Alzheimer's disease, and the number of them are expected to triple by mid-century as our nation's aging population increases. So there's a lot of considerations when we're caring for an individual with dementia. Specifically, the symptoms of dementia may be similar from person to person, and each individual is unique, and their presentation of these symptoms can vary greatly. So by creating this new training, we feel that we are highlighting some of these dementia-specific needs to really arm today's care professional with a host of tools and strategies to manage these diverse situations. And, it's about a month and a half old, so it is the newest training on the market. We're really diverse in our training as well, with a variety of interdisciplinary professionals, so everybody's perspective can be tended to.
Okay, wonderful. Can you tell us some of those professionals that you're working with on this program?
Sure. So some of the professionals that are featured within our training video, we have Teepa Snow is giving us a lot of great information around working with the behaviors and communicating effectively. We have Dr. James Galvin, who's a neurologist who's working with us as well, giving a lot of information around the brain basics. Kelly Carney from Phoebe Ministries. Phoebe is joining us as well. As well as an individual living with dementia, early onset, and her family. We have some home health aides. We have an activities director. We have some social workers and some nurses. So again, every perspective is really tended to. We even have some individuals who have recently lost folks to Alzheimer's sharing their experience.
Oh, wonderful. Well, that sounds great. Now, you recently released this new training video for healthcare professionals. What is different about it? Others have used, a variety of different disciplines as well, but what makes yours a little bit different from theirs?
Sure. So the Alzheimer's Foundation video, the AFA Partners in Care, it's a comprehensive 6-hour training video, specifically for healthcare professionals, but, able for anybody in the community or care partners or family members to view as well. It utilizes a person-centered approach, really highlighting the importance of building relationships and delivering quality dementia care. So what this is going to look like is taking the time to understand the individual in room 403 rather than simply referring him to that guy in 403. So what we want to know is, what are Mr. Jones' likes and dislikes? What times of day is he most alert? Who was he before his life was changed by dementia? Really focusing on that individual and who they are versus, how they're presenting themselves to you right now in whichever capacity they are presenting themselves. So by doing this, we have the ability to really enhance the care that's being provided and received and help ensure meaningful experience for both the individual and their family.
Okay. So in terms of building relationships, I can see how that can really help, getting to know somebody who, how they were in their life earlier on and how they are in today's world as well. Is this applicable for family and for caregivers as well?
Oh, absolutely. These skills around building a relationship can be used by just about anyone. It's not necessarily dementia specific. We do show how to use these tools and these strategies to work with our individuals living with dementia, but the person-centered approach can be used in any format and by anybody. It's taking the time to slow down. In our lives we can be so busy. And so it's taking the time to slow down and look at the person in front of us, see the person in front of us, and engage with the person in front of us. So what this is going to do for the family member of an individual living with dementia or an aide or care partner is allow them to slow down and see the person, their loved one, and not this person who perhaps has become a stressor or a frustration, and really see the person that they love and the person who still has meaning in their life and meaning in the life of that family member.
Okay, great. Now, in the video, is there like a testing process that people go through, or is there, breakout sessions, or is this something somebody just watches themselves? How does that work?
So the video is broken down into 9 different modules. The modules are about 20 minutes to, I think the longest module is about an hour. And then at the end of the video, so it allows the opportunity, since it's a self-study, it does allow the opportunity for the viewer to stop and start. At the end of the training video, you can go online and access our SurveyMonkey test. And by taking the exam and passing it by 80% or higher, you have the ability to become an AFA partner in care. It's a certification. If you are a social worker, you also have the opportunity to get CEs, continuing education credits. It offers 5.5 CEs through NASW as well as New York State, and that covers about 38 states
for
social workers. So that's a really great resource.
Well, that's great. Now, if somebody takes the test and they don't pass, can they go back and refresh and come back again and retake
Absolutely.
it? Okay.
Absolutely. We really, the point of this tool, of this training DVD, is for people to gain the skills and feel comfortable with the skills. And as learners, we're always continuing to grow, and we miss things, and we can also learn from some of our mistakes. And so, we're definitely able to help folks along, and we're here to answer any questions that people may have throughout the whole process.
Okay. Now, many people care for a loved one at home, and at some point, a lot of times they have to tackle, do I go to the hospital or the clinic, or do we make a move to an assisted living or maybe even skilled care? What are some of the things that people would need to consider in that transition, and is that kind of stuff covered in this video as well?
Sure. We have an entire module talking about care transitions and the variety of different transitions that are present or could be present within the trajectory of the illness. You mentioned earlier about having an open conversation about Alzheimer's, and part of that, as we see and we focus on in the video, is having an open conversation about care transitions, because they are inevitable, and they can be stressful for anyone, let alone an individual living with dementia. So we really encourage you to start the dialogue. I get it, it's an uncomfortable topic, but while the individual with dementia is still able to actively participate in their care planning early on, if you are able to start that dialogue, it can really be a beneficial experience. We want to make sure that we're finding out what are their wishes, what are their preferences when it comes to advanced medical directives. Having these conversations, again, early on, I can't stress it enough, can help ease the stress and burden not only on the individual, but also on their family and their care team, because it removes the guesswork.
Okay.
So the care transitions, in general, the other piece that we do focus on is the emotional component of care transitions, again, not only for the individual with dementia, but we also are looking at the family and the professional caregivers. So it's critical to find sources of support for these individuals who are also dealing with the transition. So this can look like speaking with a therapist, attending a support group, or just finding an outlet to vent these emotions. And again, planning really allows the time and space for this to happen. AFA specifically offers a national toll-free helpline that is staffed from 9 a.m. to 9 p.m. Eastern Time, Monday through Friday, and by licensed social workers. We're also bilingual, and so our helpline can provide that assistance to family and professional caregivers. We can provide referrals to local supportive services as well as a listening ear. And so that our AFA national toll-free helpline can be reached at 866-232-8484. And again, really great resource for individuals during this process.
Okay, great. And can I ask how many languages you cover, or?
So currently we are working with just English and Spanish.
Okay.
We are looking we can find resources for individuals who have other language needs, and we are looking to see ways that we can continue to expand our accessibility with a variety of different languages.
Okay, great. Now, caregiver burnout is always something that we hear about from family caregivers all the time, but I would imagine that healthcare professionals run into this burnout as well. Does your training program do any self-care for professionals and or family caregivers?
Mm-hmm. Absolutely. I mean, caregiver burnout is absolutely super real. It is can present itself in a variety of different ways, and it can be a really big challenge for all those involved, not just the healthcare professional or the care partner, but the individuals they work with and they work for. So we have an entire module attached to the video around self-care and burnout and what it looks like. It can impact us both physically and emotionally as a worker, as a provider. In the workplace, burnout can lead to absenteeism, insubordination, and most importantly, diminished quality of care. Personally, burnout can impact your sleep, your relationships, and it can increase the likelihood of unhealthy habits. So that could be around your diet, around substance use, limited activity. And so for these reasons, we do want to be able to take the time to educate professionals about ways to help prevent or alleviate burnout, and also let individuals know that they're not alone. I mean, this work is very difficult. It can be really stressful and emotional to have people needs in our hands. And so we want to make sure that we're letting people know that they're not alone. In the workplace, we want to make sure that individuals are receiving supervision or support from their directors, their managers. Bereavement support groups in facilities can be a really wonderful way to open up that space to talk about the losses that are involved as caregivers, as care professionals. And again, anytime that there's a space, whether it's a peer-led or something more formalized, to talk about the day-to-day stressors of work, it can be immensely valuable. On a personal side, leaving work at work, taking time for yourself, and ensuring that you engage in activities that you like and that you're having fun, really important as a part of work-life balance. I mean, without a work-life balance, a lot of challenges can arise in both personal and professional worlds.
Very true. Very true. That stress can really take its toll. That's for sure. On all of us, and including the person with dementia. We have to watch out for that as well.
Sure, absolutely. Again, it's a diminished quality of care. If somebody's burnt out, if they're stressed, if they're frustrated with the person they're providing the care for, they're not going to provide their best practice of care. And that's something that we're really focusing on within our training video and with anybody that we speak to as well within our education and social services department, as well as the foundation as a whole. It's just to make sure that, you take a time out, take a break. It will help you and it will help the person you're working for.
Okay, wonderful. Are there any other modules that you want to mention that we have not discussed that people could expect in this package?
Sure. So, the behaviors as a form of communication, we have a discussion around effective communication. So effective communication is the ability to listen, the ability to be a good detective. In this work, we don't always, as working with individuals living with dementia, we don't always have a straightforward conversation. So being able to take a look at the situation, take a look at what's happening in front of you, and the nonverbal content can be really important. Understanding that behaviors such as trying to get out the door every day at 5 o'clock or trying to, walk away from the group room every day at 2 o'clock, those aren't necessarily problematic behaviors, but let's take a look at what else is happening at that time for that person. So let's say the individual, we'll go back to our friend Mr. Jones from room 403. Let's say Mr. Jones used to go out from work every day. He left at 5 o'clock, and he would walk out of the door and plan to go home, where he would find his family and have dinner and relax for the evening. Those are hardwired patterns within his brain that are going to continue to be present even though he's not working anymore, and he might not have an understanding as to where he is in that moment. But he knows at 5 o'clock he has to walk out a door. And, if we have understanding of Mr. Jones and his patterns, we're going to know that he's not trying to escape. He's not trying to be problematic. He's just planning on doing what he's been doing for 40, 50 years. Similarly, at 2 o'clock, if somebody's looking to leave their office, perhaps that was when they took their lunchtime. So by understanding the person's history, getting the family involved, and understanding some of these behaviors better, usually from a historical base, we're going to be able to more effectively communicate with all those involved and, again, enhance the quality of care as well as meaningful living for that individual.
It makes a lot of sense. Makes a lot of sense. How do people, get this DVD? Is that something they go to your website, or can they get it through some of these other collaborators that you worked with on this project, or is it just through your site? How do they, or Amazon? How do they get it?
So ASA Partners in Care is available through the Alzheimer's Foundation of America's website at careprofessionals.org. You can also give us a call at 866-232-8484, and we'd be happy to help you through the process of purchasing the video.
Okay. And now, if somebody purchases this, let's say an organization does, can they do kind of a group viewing and do this as an educational thing, and then everybody take their test afterwards, or does it have to be individual kind of viewings of the DVD for this training?
No, actually, I think it's having it in a DVD format it's a great opportunity for organizations to purchase the video to use as, let's say, part of their onboarding, or to use as part of their in-service on an annual or biannual or quarterly basis. So the DVD format allows, let's say, managers to sit down their group and watch 2 modules for, the month of November, and slowly work their way through, and then everyone can take their test and get the certification. You can do a day-long training and just have everyone sit and watch the 6 hours and then take the exam. So there's a variety of different ways that you can use the DVD, and it really is whatever's going to work best for the organization. A lot of times we're looking at home care agencies where people aren't in the office as much, or case management services where people may be in a lot of home visits. So having the DVD can allow people to do what they choose with it, receive the information on a pace that works well for them, and take the exam, as they are ready, and go from there.
Okay. Is there a flat fee for it, or is it a per person who, goes through the testing? Because so many of them work in different fashions. How does your payment schedule work for your DVD?
So the fee schedule, we have different fees, whether you're an AFA member, whether you are a student or a non-AFA member. You can just give us a call and we can go ahead and break down those particular prices for you. There's a price for the DVD, and then there's additional pricing if you've got a group rate that you're looking for in regards to training multiple people at once.
Okay.
And we can break that down really easy for you by giving us a call.
Okay, great. Anything else that you want to share with us? Anything we missed?
Well, I think that this training DVD is a really wonderful opportunity for organizations as well as individuals looking to not only enhance their skills professionally. I mean, the CEUs are a fantastic asset for individuals. In addition to getting the dementia-specific training, they can also get the CEUs. But this is an opportunity for all professionals of all different skill levels to really polish their skills and refresh their memory, as well as learn some new strategies to work with this growing population. We can also learn quite a bit from this training in regards to seeing how techniques are done. There are some in-person demonstrations on the video. Teepa Snow does a great job with that, as well as some of our other professionals in the video. We also can come in person to your site and provide an in-person training. And what that would look like would be a combination of person-to-person discussion, role play, interaction, as well as utilizing the video. So that's another great opportunity for folks who may not just want to watch the DVD, but have an interaction with the educator in the room.
Oh, great. That's wonderful to know. Well, it sounds like a fantastic resource, and I appreciate you taking the time to share it with us today on Alzheimer Speaks Radio. Again, for people who want to get that training video, you can go to www.careprofessionals.org, or you can go to the Alzheimer's Foundation of America, and I'm sure you've got it listed there as well to shoot them over. And you can call, if you don't like using computers and would just like to talk to a live person, you can call 866-232-8484. Again, that's 232-8484. Well, thank you so much for joining us today, Molly. Really appreciate your time. And
thank you so much, Lori.
Looking forward to hearing more about the training program as it gets out into the world. So thank you.
Absolutely. Thank you so much. We really appreciate the time.
Great. For those of you that did not have a chance to listen to our last couple of shows on Friday, we had the Savor Your Life Education Resource Fairs on, talking about their initiative. In fact, their next one is November 5th, and you can find more information on that on our homepage at alzheimerspeaks.com. On Tuesday, on our regular time, we had Active Minds from the UK, and they just have some great, absolutely fabulous activity products and items for engagement. I just got a couple of them delivered to me the other day, and I was blown away at the quality and the classiness of these products. So check out Active Minds. Go ahead and listen to the show, and you can get more information as to how to connect with them. Our next show on next Tuesday, we're going to have Toby Habercorn with us, and she's the author of When My Grandma Forgets, I Remember, and it's a child's perspective on dementia. It's a very cute little book with lots of little lessons, I think, in it that you will enjoy. Our last dementia chats we had was October 13th, and the topic we covered for that one happened to be about pets and how important pets are for people living with dementia. And we talked about both the family pet and service animals as well. And we will have our following dementia chats next week. And again, anyone is free to join that. That's a webinar where you can actually ask people with dementia your questions that maybe you can't ask a loved one or a client. For highlights on the blog, I just want to throw out there, we talked about the Senator Whitaker introduced a bill to help combat Alzheimer's disease, and it would help legislation award prizes for breakthroughs in research and detection and cures. So that would be wonderful if you could get behind that and just send a letter to your legislator supporting that. There's also an article on safety during the fall months. And I did post one, I believe, this morning that was all about, what the heck was it about? NAPA, asking them to do teleseminars so that people with dementia or people that can't travel would have the right to still be able to participate. And that's a really important aspect. We need to have people's voices heard regarding this. And for those of you that don't know what NAPA is, it's the National Alzheimer's Plan Act. Want to give a shout out before we cast off here to the Twin Cities Hit Show, which plays Monday through Thursday live and social at 9:30 a.m. And the host is Rusty Gatenby, and he was a former KSTP reporter. And there's also Clean Justice, a comedian, and an ex-police officer, Sergeant Chuck Gallup, are part of that show. This is kind of a motley group, pretty hilarious banter over the day's hot topics, and you'll love the improv, and you'll love the Twin Cities Hit Show. It's a lot of fun. Many people have been asking about where they can see the new film His Neighbor Phil. So I'm just going to give a shout out on some of them that I am involved in. In fact, this Thursday at the North St. Paul City Hall in Minnesota, starting at 6 o'clock, we are going to be doing a screening. We are going to be doing another screening on October 29th from 2:30 to 4:30 at Polar Ridge, which is a senior community in North St. Paul in Minnesota. And then on November 12th, we have a screening in Roseville, Minnesota at 6:30 at J. Arthur's Cafe. And I've got a couple pending ones. I don't have the exact locations, but you can mark your calendar for November 22nd in Blaine, Minnesota, and December 2nd in Inver Grove, Minnesota. I have been contacted by several people throughout the U.S., and we're working on some really big fun flashes with that and really getting into doing some extensive awareness, utilizing the film as a platform. I also want to give a shout out to the Savor Your Life Education and Resource Fair, which will be happening November 5th at the Transfiguration Catholic Church in Oakdale, Minnesota, and that'll be from 4 to 8:30 p.m. So if you're looking for more information, please check that out. Last, I'm just going to give a little tip, something that saved me many times over when dealing with my mom, who had dementia for 30 years, and that is called Your Memory Chip. And it taught me to not focus so much on my tasks, even though I needed to do them. And I felt really empowered every time I could check them off. I felt like I was doing a good job. But to really shift my perception and my focus to was she safe, happy, and pain-free. And when I did that, I changed my approach, and things became much easier. And I got a calmness in my life. And many people around the world are now using this. It's a free download you can get off of Alzheimer Speaks. You just have to become a member, and then you can go into our tools. So just go to alzheimerspeaks.com and join us. And again, if any of you out there have a story to tell, we would love to hear it from you. Just contact me and tell me what you're doing to raise awareness or make a difference in our dementia care culture. Till next time, we'll see you later.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sebesta here, host of Retire Repurposed. Now this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.